companies are designed to figure out how to deny care rather than to provide care. And I think that these stories illustrate what that means for people that are living with long COVID.
Senator Smith, you were exactly right, and that's why I intend to bring the major insurance companies here. These companies make tens of billions of dollars in profit every single year. And there are very few Americans who don't have to struggle to get the care that they deserve. So that's an issue we will deal with in this committee. Senator Markey, and before Senator Markey goes, I would remind everybody that this has been an extraordinary panel, but we have 4 experts who are going to at least tell us what kind of progress we're making in understanding the disease and treating it. Senator Markey?
Thank you, Mr. Chairman, very much. Thank you for this hearing. Thank you, Senator Kane, for your continued leadership and partnership on this issue. COVID is real, and it is disabling, and we know that we have to work on it. The numbers are staggering, actually, from NIH. Staggering. That of people who have had COVID, 22% to 38% of them are experiencing long COVID. Can I say that number again? Of people who have had COVID, it's 22% to 38% who have long COVID. And that may be an underestimation, according to NIH. So even as we talk about 5% of adults have had it, think about the people who have had it and why people who haven't had it should be very careful. They should be masking. They should be getting vaccinated because there's a high probability they will have long COVID. That's what NIH is telling us. So all the warning signs are there. We thank all of you who are here for your leadership, for your willingness to be here, and I just hope people understand it. This is not going away. It's still there. And if you get it, there's a very high probability that you're going to have long COVID. So just something that I think has to be made clear over and over again. In 2018, I introduced a resolution raising awareness of chronic fatigue syndrome. Like long COVID, this illness can come up after fighting off a virus. Now we're seeing more and more people navigating both ME/CFS and long COVID, and they are fighting for recognition of both conditions. People don't believe the patient. They think that there's some phony, pretend disease that people have, when we know that's not the case. And that's what our witnesses are making very clear here today. And meanwhile, research into these and other infection-related chronic illnesses is sorely overdue and underfunded. And this has left patients without answers and healthcare providers without the training to treat them. It is unacceptable to force people to fight their chronic illnesses and a health system that doesn't recognize their illness. We need to fund research to coordinate and fund research on conditions triggered by viral infections that will drive us towards diagnosis and treatments and cures. Research is medicine's field of dreams from which we harvest the findings which we need to give help to those who are affected. So, Ms. Vasquez, in your testimony, you shared how your symptoms were dismissed in the early days of the pandemic, and health providers didn't acknowledge the link between viral infections and chronic illnesses. Ms. Vasquez, what would coordinated efforts at the National Institutes of Health to better understand infection-associated chronic illnesses mean to you and to all of those who have had similar experiences?
I think if the NIH really embraced the reality of infection-associated diseases, we could actually do some incredible science to drive the science forward. I mean, just historically, we didn't believe multiple sclerosis existed, and then we got better imaging and saw all the lesions. And now VA research has shown that Epstein-Barr virus, the virus that causes mono, is very associated to the point of potentially causing multiple sclerosis. So if we really embrace sort of the history of infections triggering disease, we can do some really cool science around microclots or viral persistence. The science is happening on such a small scale, but the U.S. could really be the leader for a cure for these kinds of conditions.
Yep, so we believe you.
Thank you.
We know you're not faking it. And we know that 22 to 38% of those people who have had COVID are not faking it. Otherwise, there wouldn't be so many of them. So it's absolutely imperative that we provide the funding for research.
Yep.
That we have our top scientists working on this issue, or else we're going to have people with this debilitating illness who have to be out there wondering why they're being stigmatized when there's an underfunding of the research needed in order to provide hope for those families. So thank you all so much for being here again today. Thank you.
Okay, this ends our panel with the patients, and I know I speak for every member of this committee in thanking you. It's not been easy for you, literally, physically, to get here, and your testimony has been extremely powerful and helpful in allowing us to go forward. So we are very grateful to you being here. Thank you very much. Okay. And now we're going to hear from our next panel.